Good morning, everyone. I'd like to go ahead and call to order our Brawley City Council and successor agency to Brawley Community Development Agency emergency meeting agenda. Today, Thursday, March 19, 2020 at 10 a.m. in our City Council chambers, 383 Main Street in Brawley, California. This emergency meeting will be videotaped and or audio recorded for posting on the city website at www.brawley-ca.gov before 5 p.m. today on March 19, 2020. Can we have a roll call, please?
The minutes will reflect all council members present.
Okay, invocation. Mayor Pro Tem Hamby, can you help?
Stand and pray. Almighty God, we're grateful to you today for this opportunity to come together in an emergency situation and lead this city, and we ask that you would give us guidance and wisdom. We ask that you would protect our town, that you would protect our county, and that you would heal those that are sick, that this virus would sweep through quickly, and that there would be minimum loss of life, minimum sickness, and that our economy would come back quickly and more robust than before. We ask that you would take care of our safety officers and our emergency services, Lord, that you would watch over them because they're on the front lines of this. And we ask that you would just protect our town. In Jesus' name, amen.
Amen. Councilman Nava, can you lead us in a pledge, please?
Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you both. Good morning to those that are present and those that may be listening. I would like to begin today's meeting by expressing gratitude for the efforts of the Imperial County Public Health Department, our state and local partners that are committed to addressing the spread of COVID-19. These are unusual times. The city takes guidance to curb the spread of diseases like COVID-19 and orders to cease certain activities seriously. Today, we will receive an update from Interim Fire Chief Mike York on our Emergency Operations Center activation. The City Council will also act to declare a local emergency. This will set the stage for next steps to protect the community and our city personnel as it relates to essential and non-essential city services. Please do your part to help stop the spread of germs and practice distancing. Avoid close contact with people who are sick. Cover your cough or sneeze with a tissue. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you are sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. Thank you. We'll now go ahead and move on to our regular agenda for our emergency meeting. The first item on the agenda is the approval of the agenda.
I'll move to approve the agenda.
Second.
All those in favor?
Aye.
Any opposed or abstentions? Okay, the motion carries. Item number 2, public appearances or comments. This is a time for the public to address the council on any item not appearing on the agenda that is within the subject matter jurisdiction of the City Council. To maintain social distancing, in-person attendance is strongly discouraged. Should a member of the public wish to provide public comments, please submit written comments via email to abenavides@brawley-ca.gov or contact the city clerk's office at 760-351-3080. The deadline to submit written comments or schedule telephonic participation was today at 9 a.m. The State of California Governor Gavin Newsom waived specific portions of the Brown Act by executive order for the period that social distancing measures are recommended and required by state and local public health officials. The waiver of Brown Act provisions requires: A, members of the public are allowed to observe and address public meetings telephonically or through other electronic means. B, procedures swiftly accommodate any reasonable request to accommodate access by disabled individuals to meetings that are accessible telephonically or through other electronic means in accordance with the Americans with Disabilities Act. C, notice of the procedure is provided for making requests for such reasonable accommodation with a notice for any public meeting. There being no public appearances or comments, we'll move on to item number 3, the consent agenda.
Make a motion to approve the consent as written.
Second.
All those in favor?
Aye.
Any opposed or abstentions? The motion carries. On item number 4, regular business. Item A, discussion and potential action to adopt Resolution 2020, Resolution of the City Council of the City of Brawley declaring a local state of emergency in response to COVID-19. And it's in your backup material.
Madam Mayor, if I may, included in the backup material is an emergency proclamation that will allow the city to move forward with a set of procedures as it relates to kind of the change in practices in both our operations and some of our ability to recoup any costs that we may incur as a result of demands on public services exceeding what we can respond to as part of kind of normal protocols. So what we have for you this morning is an update on the activities that have been initiated to date. Our interim fire chief, Mike York, is here to provide that general overview. He will also provide some information on how we are preparing to alter non-essential services as it relates to the capabilities of staffing within the fire department. Following his update in that regard, we will also hear from our interim police chief, Scott Shepard, who will provide a quick summary of where our police related services are aligned with upcoming service expectations. So both of these are intended to kind of give an orientation to how we're pre-planning and how we will prioritize certain services with an emphasis on essential services continuing.
Thank you. We'll go ahead and have Mr. York, go ahead.
Good morning,
Please,
Madam
thank you.
Mayor, council members, and city staff. Before I begin, I would like to thank Mayor Kastner-Hadegui for that message at the beginning of the meeting regarding the public and personal hygiene, as well as these prevention measures. This is by far the most important aspect amongst this emergency that we can communicate to our public, amongst our staff, and even in our own families. So please, I recommend for everybody, again, just we're going to reiterate this completely until it gets probably just rote in everybody's head. So thank you for that. Just a brief update. This morning we activated our EOC officially at a level 2 activation, which is considered staffing of the EOC when we've exceeded the resources of the local agency. Now, not to be alarmist, the only reported exceeding of the resources is within PPE for our first responders, masks, gowns, goggles, if we were to come in contact with patients that are suspected or confirmed infected with COVID-19. This is not an isolated event. We're dealing with what is actually a worldwide shortage of that PPE. We have requested items through the Imperial County Department of Public Health to the state, and we have received a shipment of some of that PPE, so we are able to currently provide our responders. However, we expect that shortage to continue. This morning, activating our EOC, we had key members of city staff to facilitate and to take on the roles necessary for the function of the Emergency Operations Center. We will be staffing intermittently. We're not requiring 24-hour staffing at this point. We'll be receiving and processing any sort of resources requests or requests for services that are outside of the normal operations that may pose a challenge to the city. We're also working on contingency planning externally with other agencies as well as internally between all department heads to ensure that that we can continue operations under the guidelines provided by the state and county Department of Public Health, as well as if for reasons of infection or reasons of personal or public concern, we have a reduction in staff. So those are very important to ensure the continuity of our city services, as well as the city manager pointed out, being able to recoup expenses and receive what are becoming critically short supplies. And we have to have those chains of communication. Were there any questions concerning the EOC activation or that?
Any questions from the council?
None.
Anything to add from the manager?
Thank you.
I think we're clear.
As for the fire department specifically, we have implemented several reductions in our service levels in light of the recommendations by the county public health. Some of those service levels they're kind of redundant because most of our requests are from organizations such as schools that are no longer operating as well, or I'm sorry, no longer have students in class. We are pulling back and we're not participating in any sort of station tours, public displays, or training of our public. We do have some minor changes to our operating procedures regarding going to residences or facilities that may have potential patients. Those changes in service level are to reduce the chances of exposing a responder, as well as the chances of cross-contaminating between incident response. We want to make sure we're protecting our responders so we can continue services in the immediate and far future. We also want to make sure that we're protecting our vulnerable populations traveling between incidents. So if our citizens are seeing a reduction in services from what they're used to, it is all based on those procedures. We're staffing a slightly different model within our stations so that for medical aids, there's only going to be a 2 personnel response where usually it would be 3 or 4. We do have the ability to upscale those when there's going to be a need for that. Other than that, station closures in terms of public access to them are following all the mandates. So all of our station, when people come in and are out of our station, even for family, has been reduced. It's only responders, only immediately needed personnel. We've canceled some trainings that were committed to participate in just to prevent exposure there. Other than that, those are the majority of the issues. We've had no problems with staffing as of yet, and we will adjust as we come across issues.
Okay, any questions? I just wanted one clarification on the emergency response for aid. You're still responding to those, but what kind of measures were you taking or that are different?
So the measures were taken for. I'm assuming you're referring to the emergency operations plan that was.
No, she's
No,
talking about for medical
for
aids.
medical
when you get a
aid.
call from
Medical
aid.
aid, yeah.
Like 2 people.
Yeah.
The standard staffing prior to this event, depending on the zone, you would either receive 3 personnel responding to your house for a call for medical aid, or potentially 4 at Station 1's area. We've adjusted our response area utilizing smaller apparatus, our squad, and now it is going to be an initial 2-person response for anything reported through dispatch that doesn't come across as a critical life threat. We receive a lot of calls for service for people that are ill, and of course we need to contact, treat, and get them moving to the hospital. However, we don't need to expose that many responders if it's not a critical, maybe such as a CPR call, a trauma, or a severe respiratory issue. So we are screening those through dispatch and responding with the lowest level that we can provide in terms of number of responders to meet the demand.
Okay, thank you. Just wanted to clarify that, thanks.
You're very welcome. As a quick update, if just to reiterate from the along these lines, county public health numbers have remained the same. In the Imperial County, we have only 2 confirmed positive cases. Those were both travel related. Currently today, we have 8 pending results. So we're testing 8 personnel right now, waiting for those results to return. We've had 29 confirmed negatives tested within our valley. As a message to our county public health officials yesterday attending the Imperial County EOC briefing, the message was put out that there has been a not a discrepancy, but people have been seeing that there's different numbers being shown, and county public health wanted to push out the message that the pending results are only pending through cases through the public health, and the negative results are showing as well as people that are tested through public health as well as through private. So if there's anything there, and they're working to update their website to address that issue.
Okay. Any questions?
Just thank you for your leadership.
Yes.
I appreciate that.
Thank you very much.
Thank
Very
you.
welcome.
Thank you.
And Mayor Kestner-Hadegay, we
Yes.
will also have an update from Chief Shepherd to walk us through some of the service level approaches that are changing as a result of COVID-19.
Good morning.
Good morning, Madam Mayor
Good morning.
and City Council members. So from the standpoint of the police department, I have been communicating daily, multiple times with all the police chiefs and the sheriff of the county, as well as agency leaders from our adjoining counties and jurisdictions in Riverside and San Diego both. And so with the response that has pretty much been an industry standard, all the police departments in our county have approached how we are addressing calls for service differently. I wouldn't at this time call it a reduction in service, but clearly we're doing things differently. Our services we provide within the city will be investigated, if at all possible, through the phone. And if we have to come to a call on a past occurred crime or event, we'd like to do that outside versus historically in a more comfortable setting for a victim or whoever's reporting the crime. So we're just doing it differently. We're not going to not investigate anything. We're not going to not respond to anything. We will respond and we will investigate. And the aggravated felonies, domestic violence calls, then the social distancing thing is not going to be possible for our officers. So as it relates to business matters and services provided at the police department, all services will be provided, just a little bit differently. We're getting a phone put on the outside, and if at all possible, in any circumstances we can, we'd like to deliver the service through the phone. Sometimes there's money exchange for vehicle releases, reports, whatever. We'll figure out the safest way for our employees to transfer that paperwork, of course, wear gloves, and it's been re-emphasized over and over and over and over, decontaminating things from the office standpoint as well as for our officers, wearing gloves, cleaning your hands, all the social distancing, all the regular stuff that we see and know. Mm-hmm. So I think it's really important to reiterate, we are not reducing any of our services. We are changing how we would respond and how we would investigate. But all crimes will be investigated.
Okay. Any questions from council?
Maybe just echo the same thing. Thank you, Chief, for not only the leadership, but I think that clarity is very important for the public. So extremely good to know, and really, for that matter, for both of you. So appreciate that.
Thank you, Chief.
Thank you. Thank you, Chief.
For your
Thank you both.
leadership. Thank you both. And Rosanna, of course,
And
for
Rosanna.
your leadership. Thank you.
Yes.
And everyone else, thank you.
So city staff and I have been oriented towards critically important for us to convey to the community and assure them that police, fire, water, and sewer services will continue, and the plans are in place to make sure that happens. Many of our services also include non-essential elements, and I would say that if we could take a moment to step outside of the public safety and public works realm, I think it's key that we let the community know that in other aspects of city services, we're gonna be implementing changes, and those began to be rolled out yesterday. The mantra is social distancing and encouragement of email and phone communication. We're also trying to manage the foot traffic that makes its way into confined spaces. So some of our city facilities don't have large lobby spaces, can't really accommodate gatherings that are more typical of people waiting in line in small spaces. So for instance, the finance department,
Super
which
confined.
is really the financial transaction hub for everything in the city, will be limiting the number of individuals who can be present in that lobby space and encouraging space outside of that smaller area to be used for a queue if it forms. We're also trying our best to encourage the use of the mail
The drop box.
drop box, as well as the online bill payment options that are available. With reference to city facilities, there are at this time operating with open doors, not posted to the exterior and locked to public access, but in areas that we can reduce traffic, we are going to be carrying out as staff that plan to be sure where we can cut down on foot traffic we are. So for instance, in this building, our public restrooms are being taken out of use, and hopefully we can find a way to address the needs of members of the public as they have emerging circumstances. Throughout our library and parks and rec facilities, the offices are available with people answering the phones, but the facilities themselves are not open for normal business. So our park facilities, due to school districts changing their format and practicing the social distancing that's recommended by public health professionals, we are not accommodating any practices or leagues. We're not turning on lights to support park facility use. Both youth and adult activities have been eliminated formally. That doesn't mean that people can't choose to take a walk in the park. It means that organized play and those gatherings of people are not being promoted. I do want to note for the record that in your backup is a draft that we're working with that really focuses on how some of our service in non-essential areas will be approached. This is available for public viewing on the city website under latest news. We are trying to consistently communicate with the Chamber of Commerce, who has been very, very helpful in getting information out to their membership. We'll also be doing some legwork in the coming days, especially as the county's public health order goes into effect at midnight Friday or tomorrow. There are some significant changes that are anticipated among business operators. We'll be doing our part to educate. We are fielding quite a few questions, and there's a ton of misinformation out there. So
very much so.
our hope will be to get facts in our community members' hands and also direct them to trusted resources. I think that's a key here, is looking to the County of Imperial's Public Health Department, COVID-19 webpage, and tracking, along with the rest of us, the progress of activities locally. There was one other item I wanted to note, included also in the backup, just as a point of reference, is the ordinance that the city has in place that governs how we behave in emergency circumstances. And I specifically wanted to point out section 9.16, which is the related to the creation of the disaster council membership. Per city ordinance, the disaster council consists of the mayor, the director of emergency services, which is later designated as the city manager, an assistant director of emergency services, and any others that the city may wish to identify and act upon adding. Included in the action before you this morning in the resolution, there is a component that includes designating both our fire chief and interim chief as disaster council members. So if you have any questions on that or wish for some other format to be considered, it is staff recommendation that we move forward with those additions today.
Thank you, Rosanna. And that is part of our packet. It goes into a lot more detail, so not sure if everyone had an opportunity to review it. If we have any other questions, we can. Follow up, yes.
We would also like the public to know that key city contact information can be found in our emergency plan. We will do our very best to be as responsive as possible. Because of the reduction in foot traffic in our city facilities, we should be well positioned in the non-essential service areas to be responsive, provided staff isn't diverted to other activities tied to an emergency response. So those phone numbers are listed in the plan, and it is also noted that on the city website, we've refreshed the Contact Us tab with designated lead personnel who will be responsible for any subject matter, being sure we're getting back to people timely. They have been designated through that page in our city website, and we're hoping we can kind of change a little bit of our normal way of communicating, but also continue to serve as best as we can, continuing needs in the community. These are, as stated by the mayor, unusual times, so we're prepared to be pragmatic. We do have a request from the area agency on aging to consider assignment of a couple of city personnel to assist with food security issues as they relate to seniors, and I'm sure we'll have more arrangements like that could be suitable for us. We take them out of their business as usual tasks and have them assigned to those purposes. So just want to make you aware, and we'll try my best to keep you updated on those types of arrangements that we're pursuing.
Okay, thank you. Thank you, Rosanna. And on that Contact Us tab, is it a number of staff, or is it primarily one or two staff, or?
The way it reads is set up is for a single point of contact, because that way only one person will be accountable for getting back to.
Okay. Sam?
Just questions. I got a call, or my wife, I think, got a call, and they were saying that all businesses are going to be shut down, everybody's on lockdown, all this kind of stuff that floats around in Brawley and everywhere else. Rumors fly around. I don't think that's the case. I think as of Friday, restaurants are supposed to close except for takeout and delivery. And I think that's the first ruling that we have. I don't think the governor's come down with anything else that any other business necessarily has to close. They are making some
I think there are
recommendations.
corporate decisions being made
Right.
in a
Right.
number of settings, and sometimes that is misunderstood or misapplied to the city taking action or the
Right.
health department.
Right.
I have fielded some questions where there is confusion about the federal guidance, state executive orders versus state guidance, and our local health department's order.
Yes.
And so while we want to educate and provide the same guidance that we're seeing through the various regulatory structures, the order really drives what the requirements are for locally, the order format. So things that are more restrictive, if the council wishes to consider alternative arrangements, we could bring items back to you if that's the way you would like us as staff to respond, or if we use the local health department as kind of the framework and ensure to the best of our abilities that that is the kind of determining.
And one thing I
Logic.
have not noticed is that they really haven't, I haven't got as many calls on city services or anything of that nature. It's more business related, and I think they're really confused out there. And I'm not so sure that they're getting all the information that they need, and they get bits and pieces of information. And I think like nail salons or hair salons, do they have to close, or they, and then there's that, like restaurants, gyms, all of those kinds
So,
of things. It
Madam
seems like
Mayor,
everybody's
I'd
a
like
little
to
bit
comment on that,
confused.
Yeah,
Councilman
I
Morton?
think what might help, and I was gonna just, since we're talking about that part, I think one of the most important things we can do, obviously, is as civic leaders, is communication. I think if staff can consider, depending, I know with some significant changes to how we're approaching business as a city and how we're providing services, probably something that I think, and I don't know if it's something that council needs to come back to, but I think we need to use social media platform to get real-time information out. I think in light of the Brown Act, maybe change in what we're able to do from a legal frame. Maybe it would be a good time, if nothing else, to put these bits of information, Sam, to your point, out accurately with reference to the city, what it means to the citizens, so they can differentiate, because there is a ton of misinformation between what you're getting through national news channels, local, through blogs, there's no other way I can think of that we can do that. And driving traffic to our website, we know that's had sort of its limitation on who accesses that. The one thing is, just about everybody has that app on their phone and can click on it. And with the amount of traffic I think we would get, I think we'd really be doing a public service if we can put out information. And I would begin with this document and post this. I
Right.
think as Councilmember Nava was able to successfully do, and I think most of us do on our personal
I think he-
sites, but I think it's about
He
time
does a
maybe
good
we
job.
consider that. And even if it's something after, maybe when we work through this, we take that down, but
Right,
right now it's
absolutely.
important.
And if I could just add a comment to that as well, I mean, we've talked about communication, and I think it's very important that the public get the same information that we're getting right now. I know there's resources for businesses. I've gotten calls from business owners that know that are gonna have to shut down. In fact, even my although it's out of Imperial, it's not here in Brawley, my daughter's daycare shut down, so I know that there's others that are going to be impacted as well. So I think the better that we can get information out, maybe it's, and I hate to put additional work on the fire department, but maybe that's a way to start, just to get the public safety message out, and we can add certainly information on business resources and maybe the facts of who in fact is impacted right now with respect to businesses and who isn't. I don't think we have to reinvent the wheel. It's documents that are probably already created. We just have to compile them and put them in there so they can view them in one spot.
So I would be happy to work with our city attorney to see what we can do, if possible. I know we adopted a policy for restricted comments. Is there a method for reducing it further? Only because I think as questions come up, we're not going to have the ability to stay on top of social media inquiries.
And
the
Roseanne, I know
same
that
time
was
as
part of
other-
it was a
yeah.
bandwidth thing, so just
Yeah.
maybe if staff can kind of analyze that in light of some maybe reduction in services, or we're changing how we're doing service. I don't mean reduction of the essentials,
Right.
but where we were talking about the non-essentials, so I want to be clear on that. And then.
If I could,
Yeah,
just
yeah.
while my thought is there, maybe some sort of like what we anticipate to be frequently asked questions, maybe, 15, 20 of those, and then just answer them. That way they're already addressed without people having to engage too much, I don't know.
And-
So, I'm sorry.
Yeah, no, and to the point, maybe the responses to any of those questions and inquiries are outlined here on what channels that we can access for information. I think we shared that right now, right, with the formation of the council and who's what. And then the other thing, if maybe our city attorney can check into, maybe this opens up, we're not on such shaky ground as council members to be able to answer a question where we have kind of refrained from doing so in the past. But I think in light of this situation, it's all about, that's one thing we can do as a council and as a team, is make sure that we're getting the right information out, and we can participate in that.
Okay. The only other comment I was gonna make is that's true that we're getting information overload pretty much from so many different websites, including the state and the League of Cities
Everything
and,
is.
everybody. And it's, a lot of it is repetitive, but if we did have something, a concise, place for our citizens here in Brawley to look at, that would be a big help. And for us to be able to respond to questions also, because then we know the answer and who to refer them to.
And Madam Mayor, I'll
Yes.
go even a step further. If there's further measures or guidelines that come out that might even prevent us to meet in person, which is possible.
Right.
This opens up a channel, a very inexpensive channel for you to be able to deliver message on things like Facebook Live, et cetera. So I just think it'd be very invaluable that we think about this now rather than when we have to.
Just as a FYI, the new meeting format, all of you don't need to be here. So
call in.
you can call in as a call-in option. Some of the challenges that we're experiencing is because of our infrastructure being limited. The call line currently would be for public comments. After that period ended, some people would be on, either remain on the call and have the ability to interrupt participation from another council member. So we can kind of work our way through it.
Any other comments? No? From anyone? Okay. We need to go back to
An actual
our
action
action item, where we were.
I'll make a motion to approve the item, the regular business item.
I'll
which is-
second it.
Just the resolution of the city council, adopt the resolution. Was that your motion,
Yes,
George?
my motion is to approve the item.
Okay. All those in favor?
Aye.
Any opposed or abstentions? Okay, the motion carries. Thank you very much. Was there any need, do you feel, to read the resolution?
If you wish to, it certainly is an option, but if not, it is included in the backup and available for public viewing on our city website.
I do believe that we've covered just about everything that's there, so unless one of you feel that we should read it, I can. What is your general feeling?
I think it's available for the public.
Okay, all right, thank you. Okay, here's that. Let me see if I can find that. Okay, moving on, item number 5 was city council member reports. I'm not sure if today we we can probably postpone that till our next regular meeting unless somebody has something they'd like to share.
I'll keep it really brief.
Okay.
I just wanted to make a comment. if I
Councilman
could.
Wharton, you're-
Just on behalf of
You have
everybody.
the floor.
Well, and I think it's been no secret, I think it was well covered by both our chiefs on all sides of public safety, but I also, as well as my primary form of employment, is also involved in public safety. So I've had numerous conversations, as you can imagine, and also operating in the ambulance industry on a national level. I just want to emphasize of not only following the guidelines, but if you can go further to not only comply, but do everything you can. That is the only way, I believe, as not just as a nation, this is a global issue that we're going to be able to, as has been often said, flatten the curve. Unfortunately, there's still segments. It doesn't mean it maybe is necessary in our valley, but there are still people that are not taking this is quite as serious as obviously as we're sharing and talking about, not just today, but everyone is. I'm really speaking to those folks. If for nothing else, not only your own family members, also think of our frontline folks that are putting on this PPE and going out responding every single day in order to help them follow the guidelines, stay home, as it's often been repeated. And make sure you're doing that, because I think some of us have seen those examples on national television where there's, spring breaks coming up and some are taking advantage of that time. And I think this is a time to take advantage of taking care of your neighbor, taking care of the elderly, taking care of the folks that you can. We have to work through this together. And I'm very assured and very optimistic with not only our response, our nation's response, but hopefully globally. So,
Thank you for that, Councilman Wharton. I think we concur. I think we all feel the same way, that we need to be safe and keep our community safe. And we thank both chiefs that are present here today for all your hard work, and our city manager and staff for all the hard work that you're doing. It's It's a difficult situation, a trying situation, but like most on the news are saying, I think we're gonna get through it. But we need to follow all the safety measures that are being offered in order to get through this safely and keep our families safe. Okay. And the next item on the agenda is the city manager report. I don't know if you have anything else to add, Rosanna?
I do. For the month of March, that really takes us to the end point in the month and the public health order's current end point. We have canceled basically all special events and facility use. As we're looking at April 1 and beyond, the question that I wanted to pose to council is whether you would like to extend a buffer period, because so many of the requests that come into the city for various facility use are 30 days in advance. So we have, for instance, a current scheduled cleanup day that Republic Services offers to the communities it serves. The other two jurisdictions, Calexico and Imperial, have preempted the schedule and opted to cancel or postpone to a future date to be determined. I was contacted by Republic Services and explained to them, we have utility billing inserts that are scheduled to go out in the mail at the end of this week. They haven't gone yet.
Yeah.
So we're kind of in a critical window where we haven't gone public with the date, so in any extensive way. My question to council is, would you like to retain the date and the option to cancel when the date's closer, or do you wish to simply postpone for the time being?
I would say postpone.
Yes.
Okay.
There's no need for it.
Yeah.
I don't think it's a
It's
necessity,
not,
I agree.
it's not necessary.
Although there wouldn't be a lot of person-to-person contact, I don't think it's necessary to do it. It just brings a lot of
Yeah.
people together in one
Plus the
area. and I don't think
participation
that's a
level.
good idea.
Re-
Participation levels would not
Republic
be
Services
very
said the one-on-one contact is typically helping people to lift or remove
Yes.
items from their vehicle, that they could practice some other measures.
Not close contact, but I still think postponement, because I
Okay.
think people won't be willing to bring their stuff.
Okay.
And then there's a whole bunch of things that enter into that picture. I just think, under the circumstances, and April 18th, if it was further along in the month, we might want to take a look at it a little differently. But I think in the middle of the month, well, I think we're still going to be in this kind of situation, at
We
least.
gotta give
And
ourselves some breathing
Rosanna's,
room.
yeah.
yeah,
there's some of that.
absolutely, and maybe just reiterating the fact that customers are still able, if they do have a large item, they can still individually go and
I
take it
believe
down.
actually the dump
is
some
restricted. Okay, I don't know.
restrictions
That-
are in play
Yes.
countywide.
Yes.
I can get that information.
Maybe get that too, because
um,
people are going to want to go do the different things.
Okay.
They are picking up the trash.
Yeah, maybe we
Um,
can include that in our,
Yeah.
in the
Yeah.
summary of
We,
services.
we did cancel Dancing with the Stars, which is scheduled for first part of May, and there's a lot of reasons behind that.
that canceled?
But you're not sure, and then you've got all this
Yeah.
money invested.
Yeah.
So basically, when we cancel that for the year, that will not be until the next year.
Next
So some things are happening that way and some are postponements. This could be a postponement, and we could still do this almost any time during the course of the year.
The other request that's come forward is from the federal government, and it relates to Marine Air training and use of our airport facility. And that is scheduled for the first week of April. The Yuma team was in contact this week just inquiring whether their plan is to continue training, but they wanted to be sensitive to the fact that perhaps the activity could be unsettling and wanted to open that dialogue with us. And so
It's
gonna-
martial law.
I know, it's
Yeah.
gonna
So
look like,
People might get.
what I explained to them is we've always been
Cuba
very
Gooding Jr.
welcoming
coming,
of
yes.
their
Yes.
presence,
Yeah.
but I wanted to bring it forward and see what councils, if you have any strong opinions about it. Typically during the training period, what happens is there are people primarily in civilian clothing that are just in town in vehicles, but sometimes the increased air activity, people confuse with the work of law enforcement.
Yes, all
it's gonna
kinds
look
of-
like outbreak if
other-
we have that, it's gonna,
I
honestly.
think so. I think it's gonna make people uncomfortable or,
I think it's good to have it when there's no school, but, but I think that, yeah, I think people might overreact, although communication might be the key there. I mean, I
Yeah,
don't know.
that's another, maybe a
I
good
don't
point.
know.
Facebook.
You know, I mean, if
that's
you
why
had
that
enough
It isn't martial
communication
law.
around
Yeah.
town, and if we went around and talked to everybody about it and said, this is just the standard Marine training, whatever. But I don't know, maybe you need to talk to them and ask them, are they willing to put their people out here on the street as a group, you know, and interact with? And
They're willing
some
to do
people
that,
maybe-
but the proactive communication, what we do is internal. It's not an external press release about Marine air training occurring, and that
Yes.
has been, there's been maybe a little reticence to
Yeah.
promote the activity in that way. So what we try to do is alert dispatch and all of our various departments so that we can be part of getting the proper responses
Little touchy.
advanced.
It is touchy.
It is touchy,
So-
I think, because even when we don't have anything like this happening, we still get calls sometimes from
Maybe we could
concerned
ask them to
citizens.
postpone that one.
They want to
for
be
a time
respectful
period.
of local wishes.
Maybe
They greatly value our
postponement.
relationship.
Yeah, maybe a
so-
postponement until a little bit
can.
later time.
If they
I mean,
can,
if
I
they
don't know if they can
can, I mean,
postpone
I
or
don't know
not.
that they can.
A lot
or
of
can't.
people
What's the
that they're-
date of that?
It's the first week of April.
Yeah,
See, and that's a tough
right around
one
the
because
corner.
it's
I
right
mean,
around the corner.
I think people are getting even more.
The other thing is if the National Guard's
know.
activated, if all that stuff happens, then there's gonna be a military presence probably in every town, city, et cetera. So, I mean, that's something that might happen anyway. We don't know that. I'm just saying that that's a possibility. But I do think it's gonna make people a little uncomfortable. I think we can communicate with most people, but there are always gonna be some that are a little uncomfortable with that.
I think it goes back to the point Donnie's made as well. I mean, just going back to even something simple on social media where people can just go and get the right
Yeah.
information, and that can be shared amongst all of us, you know, to where people can like the page and they can get updates on that. I think that's a very good way to share information. As long as it's clear, concise, accurate information. We don't have to reinvent the wheel. It's just
And I agree, but I do think we need to make a decision. We're either gonna let them or we ask them to
Yeah,
postpone.
we need to make a
It's
decision.
that, we either communicate, we make sure we communicate and let them do it, or we postpone it, and I don't know what.
I'll just share a perspective and absolutely not, you know, saying, it's just, we all have different perspective. To me, this is, how long have we been doing this?
Years.
A long
It's
time.
been years, okay. I think there's a certain segment, at least within, or throughout our community, that sort of know and understand that, right?
Yes,
'Cause
I
they've
do.
asked the
I
question
do.
before. So I think
Yes.
this isn't new. This was the first time they were gonna do that. I think it would be a unanimous, just, you know, no way, maybe the timing's bad. Number one. Number two, the other thing, I think it's a point of pride for actually a lot of members of our community, not just the veteran community, but I think there's a lot of folks, and obviously there's the side that, there's the complaining side, right? Because it does create some noise and some disruption. But to me, at the end of the day, we're supporting, it's a very, maybe a small gesture on our side as a community for a very big picture, and I think our defense, our national defense, and our, you know, men and women in uniform, all that again, they're obviously performing this mission because it's part of a large mission of what they do, you know, globally. So to me, it just, if we can communicate it, I think that'll be important. The other thing is we have no idea, just I think as Sam mentioned, what the scenario
happen,
may
yeah.
be, you know,
Yeah.
in the next few weeks. So. There might be some of us that think it's reassuring to have, you know, our military, you know, and whatnot around. But anyways, that's not a here nor there on, you know, proceeding or not proceeding. I will certainly go with council sensitive to all of the community. But I think there's a good portion of our community that see this every year and they know
And
it.
if we can communicate it in advance, that
Yeah.
might be, there's still
We could get it out
time
right
between now
away,
and,
but we gotta make that decision.
Yes,
We get it out right
Yeah.
away. We need to
Yeah.
start communicating today.
Yeah.
but
And we
everything,
need to go
about
forward
everything.
from
I think that'll be important, yeah. That'll be huge.
Because I can tell
Put it in
people what's
the-
gonna happen. I mean, as you walk around, as you talk to people, you can tell people, and on Facebook, you can communicate with them. You can tell them what's going on. As long as they're aware of what's going on, it's not something, it's a routine, I think that's acceptable. But we'd have to really communicate, and I think that's really, really important.
Maybe
And
ask
I
the
don't
commander.
think their comfort level has always been, again, on that outward.
Then you might wanna
Ask
tell,
them.
why don't you
Yeah.
ask them
Ask them and see
Yeah,
what
and
they
that's
see
say.
what
true.
they say, because tell them we're gonna have to communicate this a lot more, or
Ask
they
the
need to
commander
postpone.
for a comment.
I'm sure, yeah,
No, Ask the
exactly.
commander for a comment of, you know, whatever, you know, again, and they have a, you know, press officer, you know, and a public relations officer,
Yep.
but this is special time, so we can use some assistance on making sure that we're informing our community, so I would ask that.
That we,
You know, let me just say, I'm sure Donald has, his schedule's been disrupted. David, my son, you know, if the Marines are going forward with this training, it's important.
Yeah,
Because
I figured.
the Navy, the helicopter squadron,
surprised they
my
haven't
son,
stopped.
they've told everybody stay home.
Yeah, I think
So
they
if
may
they're- if
wind
they're
up
gonna
not
go forward
having
with
it.
the training, it's important training, and we oughta support it.
Mission critical.
Yeah, maybe it's mission critical.
Maybe,
or
yeah,
else they may
Rosanna
make a
reaches out to
decision at the
them.
last minute not to do it.
Like you say.
Okay.
So
There's a whole bunch
Rosanna,
of things that
depending, I guess, on what
Yeah,
the
what he
commanding
says.
officer tells you.
Okay.
Tell them we've got to communicate it a lot this
If it's
time,
not
if they
essential,
want to
then
do
don't
it.
Yeah,
Okay.
but if it's,
Gotta get going.
Got it.
Yep.
Thank you very much for that direction. I appreciate it.
Was there anything else, Rosanna?
Not at this time.
Any questions for Rosanna? Any more clarifications? Okay.
No,
Question? No? Okay.
I'm sure there'll be questions from the
We already
public.
covered the postponement of the
Yes.
Republic Services.
Everything's
So
good.
that will conclude our meeting. Thank you all very much. Our meeting is adjourned.
Thank you, everyone. Have a good day.
Thank you.
Thank you.